So I guess we'll do a little bit of a story from here. The little story is that this is Steven Sapiro. He's one of our patients we got permission to do all this from a little bit ago. But he's a type O vegan. And being a blood type O vegan is it can be a detrimental thing to your health. It's not saying there's anything wrong being vegan or anything wrong being vegetarian, or if that's your religious practices, that's fine. The problem is when we have people that come in, they're sick, and they refuse to change. There's something going on there. There's some kind of ego presence there, and they need to kind of open their mind up. So this is kind of what happened with Steven Sapiro. He's blood type O vegan. He became vegetarian in 1999. You name it vegetarian-wise, he was a trivia contest winner, he wrote books, he's on the board of directors, a very devoted and passionate person, which is the type of people that we love. And then he got sick. He got sick, you can see those little spots up there. He got sick in the mouth. He had pemphigus vulgaris, which is an autoimmune condition, blood type O, autoimmune condition where your body attacks its skin cells and makes these blisters. And they started appearing in his mouth in about 1995. He started losing weight, he couldn't eat anything, and then he was diagnosed finally with this disease. And then from there he was given cortisone, which is it's steroids. He was given steroids to suppress the immune system so he could actually live. And he didn't like that. He didn't like taking medications because it wasn't doing anything. It was just kind of suppressing the symptoms. So then he tried to do a whole bunch of different things. You can see on the screen now. Vegetarian diet, raw food vegan diet, vitamins and minerals, yoga, candida, homeopathy, acupuncture, Chinese herbs, And you can imagine what I'm going to say next. He finally picked up Dr. D'Adamo's original book, so 19 books before where we are now, Eat Right for Your Blood Type. And he started following the diet, and it started going away. This was amazing. It started going away. But then he decided to test it, and it'll start to come back. So he's like, oh, I got to eat this way. And he started following the general, simple blood type O diet. Some meat, some nice vegetables, not necessarily those carbs as much, but some meat and vegetables for the most part. And he found out that if he followed this diet, he was actually able to avoid the cortisone, and he wouldn't get the inflammation and the reactions. So his body was so worked up that when he got sick, when he got predisposed, his body was attacking itself, and he had this condition going on. But he had a big controversy of this in his head. I mean, he was a devoted vegan, vegetarian, animals' rights activist. He did everything, But the problem is he became desperate. And just like when you see those ads on, not the ads, but the kind of it's not even a word, infomercial on the airplane, they're doing the safety procedure. They always tell you to put the oxygen mask on yourself before you put it on anyone else. And he had to worry about his kids, he had to worry about his family. I know if my nieces and my nephews were sick, I would need to make sure that I'm sick so I can help them out the best. I gotta take care of them. So it's the same thing that he had to do. He had a wife and kids and a family, he had to take care of himself and give up his ego and try something different. And it worked for him, which is great. And it's one of those very important things. He refused to die for his cause. The update's a little bit old, it's from 2012, but he's still following the diet. But he's been good. He hasn't been on cortisol. He's been following it very well. He hasn't had any other treatment. So cost of treatment right there from burden disease, he doesn't have to use an insurance anymore to pay for cortisone. So that's going to reduce his insurance premiums. All that good stuff just by preventative medicine, using your diet. Something that you do hopefully 3 times a day is very important. The doctor of Western medicine, because this is Western medicine, naturopathic medicine is completely Western medicine, he said use food as your medicine and medicine as your food. And that's very important. That medicine that we eat 3 times a day is very individualized toward you. So this goes into, what is your blood type? And, I invite all you, if you want to come, later, there's a little postcard back there, you can grab it, you can make a 5-minute appointment, we can talk kind of briefly, kind of meet and greet, I have it listed, and I can give you your ABO positive blood type. If you want to come for an appointment later, we can, we order more different blood types and that kind of stuff. We don't actually do the blood type diet anymore. We use that basic information, we build upon it, because we like to work in with the SNPs and the genetic information and the genetic data. We use something called a SWAMI diet, so it's actually a computer program that we take all these measurements, so your blood type, and all that good information for medical history, what drugs you were on, if you're on drugs, what nutrients you're depleting. If you need vitamin A, we'll increase that in your diet. If you need zinc, you increase that in your diet. And it comes out with a very individualized diet meal plan for you. You actually have a better chance of winning the lottery than getting the same diet as someone else. And you can just see, so here's the live food section. It'll have all your good foods, all your beneficials, all your neutrals, and all your voids. So medicine, calories, toxins. And it goes through this for all the different kind of categories. It's very unique and special because we can treat you as an individual. And that's one of the reasons why Dr. D'Adamo over the years has gotten a lot of gripe against him. Because the vegan people hate him because he's telling blood type O's to eat meat. And the Paleolithic people hate him because he's telling them blood type A, Z, and Mediterranean diet. And the Atkins people hate him because he's telling people to eat this diet and that diet. So he gets a lot of heat from that. But he's looking at it from the point of view of, hey, I don't have an ego, I'm here to help the patient, do the best I can with the patient. This is a diet that's going to be beneficial for you, even though these guys are saying something, these guys are saying something. Do it, try it, you won't regret it kind of deal. And it is evidence-based. Everything that we do here is evidence-based. The diet is evidence-based. It's a whole foods diet that's individualized for you. So we're telling you, good organic meat, grass-fed if you can, no toxins, no GMO, that kind of stuff if you can. And it's a work in progress. If you want, please visit my website. It's brodynd.com. If you can like me on Facebook, that'd be great too, BrodyND. And if you want to follow me on Twitter, it's @BrodyND. So with in doubt, it's BrodyND. Please check me out. If you have any questions or anything like that, I'll definitely be more than willing to take them for now. Please make sure you grab some of the brochures, and there's an old newsletter back there. Excuse me, we don't have any of the new ones. They kind of went out really quick. Protein bars, stuff like that. I'm going to try to do this once a month. I'm going to do some kind of topic next month. I can take some suggestions if you want. If someone wants to talk about heart disease or men's health, women's health, stress and fatigue, or anything along those lines, just please tell me, and I'll use your information to let me know what I should do. So if anyone has anything,